Hi, doctor. Glad to connect back with you in our show.
Thanks a lot.
This time we'll talk about hair and hair care.
Okay.
So we'll start with the common problem that every one of us face, that is hair fall. Irrespective of the age, irrespective of the gender, every one of us are facing hair problem, hair fall. What could be the reason for hair fall, and is there any permanent solution or treatment for the hair fall?
See, coming to the hair fall first, let me go a little bit of the anatomy of your hair cycle. Okay. Normally, your
Okay.
hair cycle is there 1 month. Okay, which is around 4 weeks. So it is getting. There are three different phases in the hair cycle. First one is the anagen phase. Second one is the catagen, and third one is the telogen. Okay. Anagen is the growing phase of your hair cycle, okay, where the hairs grow. Catagen is the transition phase, where it is getting transformed into another phase. Telogen is the resting phase, which where you will see there are hairs are falling, okay. Normally,
Okay.
losing up to 50 to 100 hairs per day is considered as normal, okay. When those 100 hairs are not coming back or it is increasing in the number of hairs you are losing, then it obviously comes as a hair fall. Okay. When we
Okay.
think of a hair fall, we should think of few things. Okay. Whether when you are getting early in the morning, can you see hairs on your pillow? Okay, that indicates is obviously there is a hair fall, which is of concern, and you should contact a person for it. Or once you are
Okay.
taking a shower, yes, you will have a hair fall. But when you are drying your hair, whether the hairs are stuck to your towel, okay, whether many hairs are stuck to your towel, that is also one more thing indicating yes, you have a hair fall that has to be that has to be taken care of. Okay, these are the some things which you can notice in daily routine things. Okay,
Okay.
coming to the hair fall, there are n number of causes starting from is your general condition, okay, whether your nutrition is good, in that sense whether your diet is rich in green leafy vegetables and fresh fruits, okay. Then if you are sitting inside a room and you are not getting exposed to the sunlight, you will have a deficiency of a vitamin D3, that also adds on in it. And pure
Okay.
vegetarians will have a deficiency of vitamin B12, okay, and that will also
Mhm.
add on to your hair fall thing, okay.
Okay.
And other hormonal imbalance like your hypothyroidism, your periods are irregular, or if you are taking any steroid tablet, that also adds on. And nowadays trend is for different kinds of a hair color or straightening. I'm not telling they are bad, but once you get it done, please do make sure you're using proper protein which are serums which are available for your hair. If you are not using those things, your hair will cut in the middle and again it adds on to the hair fall. Okay, and imagine any one of us is suffering from any chronic illness like typhoid, jaundice, or
Okay.
any other problem. In the recent time, yes, you can think of COVID. Yes, once we are getting affected by any illness, that shows on your face and hair. What happens? Hairs
Okay.
from growing phase will go to the resting phase. Once they are gone to the resting phase, the hairs will start shedding off. Okay, this we call
Mhm.
it as telogen effluvium. Even in pregnant ladies, you will see yes, the hairs will grow in length when they are pregnant, but post delivery, the hairs will start falling off. This is all
Okay.
where the hairs from the growing phase they have gone to the resting phase and the hairs are shedding off. This is called as telogen effluvium. In the kids, if you come to say two main things are seen. One is coin shaped hair loss, where they will have patchy hair loss. There you
Yes.
have to rule out two main things. One, whether it is alopecia areata or it is a fungal infection. Okay. In fungal infection, if you will see whitish scales in that area and you can see a patch, you can take the scrapings and send it to the lab. They'll confirm whether it's a fungal infection, then treat for a antifungal treatment. If it is
Mhm.
a alopecia areata, here something is produced against your hair cells. So only in that patch the hairs are getting destroyed. Okay, here the
Okay.
treatment of option is again different. These are the things, and some of them, especially in male, there is baldness. Okay, that
Mm.
we call it as male pattern hair loss that runs in the family, and it is like from one grade to another grade it passes off. Okay, it is hormonal dependent. Okay,
Okay.
especially the male hormones testosterone and dehydroepiandrosterone. These are the two things. Yes, these are essential for your body, but when it comes for the hair scalp part, it acts ulta, vice versa. So it reduces the blood supply and the growth factors for your hair. So that starts off with the thinning of hair, then the hair fall, then the baldness starts. Okay, that we call it as male pattern hair loss. Yes, some of them they do have undergone some surgeries post after which the hair fall
Mm-hmm.
is there. That comes in the category of telogen effluvium. Then
Okay.
any other body conditions where there are diseases can, for example, cancer chemotherapy, because of the radiation and all, they also lose hair. Okay, so that
Mm-hmm.
also falls in the category of your hair fall. So if you take commonly, yes, telogen effluvium is one thing where there is dandruff or any disturbance in the body, the hairs from growing phase to the resting phase they go, and here it sheds off, that we call it as telogen effluvium. Then comes your alopecia areata or tinea, fungal infection. Then the male pattern hair loss or the androgenetic alopecia, which is most commonly running in the family. That's what it is.
Mm-hmm.
And apart from that, if you consider, there are few people, yes, the hairs are thin, very thin and soft. That can be in the
Okay.
family only, some of them they had it, it is continuing with the other person. These are the most few common causes which you can see. That's what it is for hair fall.
And is there any specific treatment? Suppose the person is getting a lot of hair fall. It could be any of the reasons which you have mentioned just now. Is there any specific treatment which can be offered so that he get the hair back or he get the hair fall, reduce the hair fall?
See, if at all initial stages, example, telogen effluvium, your typhoid, stress, or your dandruff, these
Mm-hmm.
all conditions can be treated and your hair fall can be controlled and it can be treated also. Once you go into the baldness problem, the treatment option altogether it is completely different only. Normal
Okay.
person with the history of any fever or post surgeries or any person who is recently discovered with the thyroid problem, they'll come to you first, assess the severity of the hair fall, ask them the complete details, what all they have been doing, how is their diet and all. Then yes, if they tell yes, I am a vegetarian, I do sit inside a room, you need the basic
Mm-hmm.
evaluation of their thing. Get a blood investigation done. Okay.
Okay.
Along with that, there is a microscope with which you can examine the scalp of a patient. You can see
Okay.
how is the density of, whether there is a oiliness on the scalp or whether there are any scales on the scalp. Yes, if there is any other condition that needs to be treated, along with that, yes, ask them what they are using for their hair, like which shampoo or any vitamin tablets they have been started or what they are using. Okay. Then comes
Okay.
their home care. In the home care, you need to start on with the shampoo, yes, which is free of sulfate. Okay, over the
Okay.
counter, any shampoo you take or the lather what they give, yes, there will be more of a sulfate, what we say. The medicated
Mm-hmm.
shampoos will have less of it and it is good for your hair to control the hair
Okay.
fall. Okay, so change the
Okay.
shampoo, start with the vitamin tablet, and there are hair peptide serums which contains the vitamins like biotin and other saw palmetto kind of a things which are necessary for your hair fall topic. You can start on
Okay.
that. Along with that, if the hair fall is still much more severe, yes, you do tell them there are treatments which are available. One can be PRP or the GFC or just the laser helmet kind of a treatment which are there. They can be started. Yes, by third or
Mm-hmm.
fourth session, the patient will start seeing the changes or the improvement in the hair fall. That's what you can
Okay.
expect in PRP or GFC. Yes.
Okay. So, doctor, we were talking about dandruff, so which is one more common problem that everyone are facing now. Why this dandruff comes, and again, is there any treatment if it continues even after many shampoos or even after many months? Is there any treatment or any solution for the dandruff?
Okay, first of all, why the dandruff is there? Okay, first thing is there are oily glands which are called as sebaceous glands on your scalp. Okay, that is
Okay.
producing oil and that is adding on layer by layer. If you are taking once in 3 days, thus it settles
Mm-hmm.
layer by layer on your scalp only. It comes as a flake. Okay. Then
Okay.
the other thing is like there can be little bit of a fungal infection or a bacterial infection for your dandruff. Okay. So you
Mm-hmm.
can start with the short course of antibiotics and the antifungal orally. Along with that,
Okay.
stress increases your dandruff. And
Mm-hmm.
you should ask your patient how many days in a week they are taking head bath. If it is
Okay.
once, make sure at least minimum 3 times a day they are taking a head bath. Okay, so that the oiliness of the scalp can be washed off. That's what it is. If there is too much of a dandruff, we do start them on a anti-dandruff shampoo. Mainly, these will contain ketoconazole, which is an antifungal shampoo. So
Mm-hmm.
whatever little, and it reduces the oiliness of the scalp also. Ask them when
Okay.
the dandruff is severe, they can use it twice a week. Later on, once
Mm-hmm.
the dandruff reduces, they can use it once a week or once in 10 days. It's like your
Mm-hmm.
dandruff can be very well controlled. If you are not taking care of it, yes, it will increase. Weekly once must and should use an anti-dandruff shampoo and minimum three
Okay.
times a week take head bath. Okay. And the other
Mm-hmm.
things what we do is we wear a scarf when we before wearing a helmet. Those
Yes.
scarves need to be changed every day. Otherwise, the sweat remains there only. It acts one more medium for increasing your dandruff. That's what it is.
Mm-hmm.
And the other thing is Indians, we have a myth. Yes, you apply and keep oil for 2 days, then take head bath. Okay. Here
Yes.
again, you are increasing the dandruff. Yes, your oiling is good, but it has to be 1 to 2 hours before your head bath. Your oil
Okay.
will never grow your hair. It is your diet which is rich in vitamins and minerals, green leafy vegetables, fresh fruit that is growing your hair. Okay. So oil, what
Okay.
it is doing in your hair, outer covering is keratin, which is a protein. So we are
Mm-hmm.
using a harsh shampoo. We are getting exposed to the sunlight. That will be damaged when you are constantly using a shampoo or getting exposed to the sunlight. So why we tell them apply a oil? Yes, it is when you are using a shampoo that oiliness only goes. The keratin of the hair will be undisturbed. So whatever the
Mm-hmm.
in between you will have split ends or the cutting of hairs in between. You will, some of them they do tell doctor from the root it is not going, but it will cut in the midway. So the shampoos what you are using without using the oil, it is damaging the hair. That's what it is. So apply a oil. Oil massage is also good, but it has to be maximum 1 to 2 hours before your head bath.
So, doctor, applying oil, when we talked about this applying oil, massaging head with oil. So, I have just got a question like, which type of oil is good for massaging of hair? Like, we have many oils like coconut oil, mustard oil, many are coming in the market. So, which oil is very good for the hair?
Any oil, all the oils do that same job. Basically they are
Okay.
protecting your hair. Okay, other thing,
Mhm.
when you are doing a oil massage, because of the warmth when you are doing the massage, it increases the blood supply your hair. So in
Okay.
turn it is helping your hair to get a good blood supply, and it is helping the damage which is caused by your shampoos by
Mhm.
protecting the keratin of your hair. Okay, so any
Okay.
oil just 1 to 2 hours before your head bath you can use. Nowadays, yes, of course, there are few medicated hair oils are also coming. You can use them also.
So again, we were talking about hair oiliness and everything. So some people says my hair is oily, or some people say even after keeping and chewing shampoo, my hair is dry hair. So why this dry hair or oily hair comes? Is there any specific reason of? Is there any specific reason that causes these two kinds of hairs, or is there any treatment if at all anyone having such kind of hairs?
Too much of a oiliness, we call it as seborrhea. It is basically the sebaceous glands are active. In that case,
Mhm.
yes, you do give them a anti-dandruff shampoo. If there is too much of oiliness, yes, tell them even if they wash every day the hairs, it won't be a problem. Yes, once a week, must and should they should use the anti-dandruff shampoo. And if you see
Okay.
any dandruff part is there, start them on with the oral antibiotic or a oral antifungal tablet. They should be fine. If there is too much of a dandruff, yes, we do give stay on lotions for us on the scalp to be applied for 15 days in the night. That will get it under control. Then coming to the dry hair, it is like they are not maintaining it properly. Probably with the harsh shampoos or the overuse of your hair dryers or the other things what they are getting. If they are applying too much of a mehendi for the hair, that also makes dry your hairs. Okay, so what they are using, just look into it, change the things what they are using. So that will
Okay.
cure their dry hairs also. And the oily scalp, yes, it can be well treated like a seborrhea or the dandruff.
Doctor, when we talked about hair growth and hair fall, so you were mentioning some treatments, which is one of like PRP. So, for what this PRP treatment is used, and is the treatment is painful?
See, PRP is platelet-rich plasma. First of all, it is completely safe because it is done from your own blood. We take around 10 to 15 ml of your blood. We centrifuge it, okay? So when we are
Okay,
centrifuging it, we are separating the WBC, the white blood cells from the red blood cells. This white
okay,
blood cells, we call it as the PRP, which is platelet-rich plasma, which is rich in growth factors, okay? Because of
mhm,
the other things like stress, diet is not good, you have recently had a fever, because of which hairs are getting less of a nutrition and the growth factors. This PRP serum acts as a natural thing which is prepared from their own blood and injected back to the scalp. Usually done once in
okay,
3 weeks or once in 4 weeks, around 5 to 6 sessions of it. Okay, what it
okay,
does, it gives back those growth factors for your hair. So first and foremost important change what you will see immediately after a session of PRP is your hairs will start looking healthy. Gradually,
mhm,
session by session, the patient himself or herself will say, Doctor, yes, the number of hairs which I used to lose has come less, has become less. Okay. So,
okay,
and if the hairs are thinning out, they will help you to thicken up your hair. So, with the PRP, you can stop the hair fall for sure. Yes, your thinned out hairs will thicken up and you can maintain what you have in case of male pattern hair loss. In case of telogen effluent, of course, with the proper nutrition, these hairs will regrow back also. And
okay,
basically, those patients where they are bald and have little bit of hair and they want to maintain that kind only without going up for
mhm,
a hair transplantation, this PRP is definitely helpful and it is of no side effect since it is prepared from their own blood. Coming to the pain bearing capacity, yes, you will have a pinprick sensation for which, yes,
mhm,
you can either apply a anesthetic gel spray or some of them they do take like that only because it is done from very thin insulin needles. So some of them
mhm.
they are comfortable without any anesthetic spray also. Yes, it will give you good results. Little bit of patience you have to have because second or third session onwards, yes, the results will be obvious and you will be happy about it.
So, we were saying like little sensation while having this treatment. So, is this only during the treatment that sensation or pain happens, or even after the treatment also the pain continues for some time?
See, they can. It is a different opinion if you take. Some of them
Mhm.
they do tell after the post procedure they are completely fine and comfortable. Some of them, yes, for
Okay,
one day there was little bit of a pain. Usually we do ask them take a head bath and come for the PRP session. Then
okay,
leave it like that only post procedure for 24 hours. Then take a
mhm,
head bath next after you complete your 24 hours. Okay, with the lukewarm water. So where they
mhm.
are not using hot water, so not much of a pain they can feel it, and they will be comfortable with the regular process as it passes by. That's what it is.
Doctor, heard of one more treatment named as GFC. So, is the GFC also for the hair growth? And again, the same question, like, is it painful, or how and why this treatment is for?
See, PRP is basic first, then GFC is the next version of your PRP you can take. GFC is growth factor concentrate. Here, the tubes that are used for GFC are different and some concentrates are there so that it releases the growth factors much more and much more quickly than compared
Mhm.
to PRP. In PRP, if we take around 15, 10 to 15 ml of blood, in GFC we take 15 to 20 ml of blood. Okay. In
Okay,
PRP, immediately after withdrawing the blood, we keep it for centrifuge. Whereas in GFC, it has to be kept in those tubes for half an hour. Then it is kept for the centrifuge. Okay. And coming to the the most common difference is the concentration of growth factors. What you get from GFC will be more than compared to your PRP. Okay, there
okay,
can be wastage of growth factors in your PRP, which is very very minimal in case of your GFC. Same like PRP, it is also done on the scalp either with the anesthetic spray or without it. Yes, once in 3 weeks or once in 4 weeks. Once in 4 weeks. Okay, around 5 to 6 sessions of it. If there is
mhm,
too much of a hair fall, yes, the number of sessions will vary from person to person. Yes, obviously, compared to PRP and GFC, yes, you will see. a little bit quicker result in GFC than your PRP. That's what it is. Same PRP and GFC can be done for the face also. It acts as a good
Oh,
rejuvenating agent. Yes, it works for
okay.
your fine lines, your pigmentation, all those things. And it is the safest also where people are worried about using some external product. Yes, it
Yes.
is prepared from your own blood and it can be used both for face as well as your hair.
Okay, okay. So, doctor, we have talked about two procedures, PRP and GFC. Now, take an example of pregnant women post-pregnancy or after delivery is done. So they'll have a hair fall, lot of hair fall and different concerns. Can they also opt for GFC or PRP, or they need to be avoided such treatments, or is this
It's
PRP
like
and GFC can be done for anyone?
it can be done for anyone. Think about the condition, examine the scalp.
Okay,
If you do a PRP or a GFC on a bald patient, it will never give you hair. Please tell them. It is
okay.
like basically in a bald person, it is like it may not grow new hair. Okay, it is not
Mm-hmm.
documented whether your PRP or GFC will give rise to new hair. Okay, so basically, yes, some of them they do tell yes, I got new hair, but not with everybody. Tell them if you are
Mm-hmm.
expecting new hair, especially in bald patients, not about every condition I'm talking about, it may not give. In case of pregnant ladies or post typhoid recovered patients, yes, you can definitely go with your PRP or the GFC. It definitely stops the hair fall and whatever the density they had earlier, it will come back. That's what it is. When you are coming with the hypothyroid or a PCOD, I would say together. Treat for your hypothyroidism also, treat for your hair fall also. So if
Okay.
both the treatments are going hand in hand, the results will be quicker and faster. You treating only the hair fall, not concentrating on the main part, which is your other problem, you may not be satisfied with the results. That's what it is.
Okay. So again, we were talking about bald head where PRP and GFC may work or may not work. So why this bald head comes, and especially I see many men will get bald heads, and why bald head comes, and is there any treatment just like to grow the hair? Is there any treatment for bald head also?
See, baldness in males, females will have thinning, males will have the baldness, right? In males, there are up to eight grades. In females, it's only
Oh,
three to four grades. Okay, that's what it is. Yes, when there is a visible baldness, you have to go for a hair transplantation. The main most common thing is yes, your body hormones and the family history. Anybody is bald in the family, you have a chance of getting it early and the stages also
okay.
proceed from one stage to other stage quickly. So first when the patient comes to you, see the scalp, see the area of baldness and along with
Mhm.
that also see the back side of your hair which is called as the donor area. Okay. If you see
Okay.
when you are seeing patient it's a U-shaped baldness, the donor area will be good. Okay. If the
Mhm.
donor area is not good, yes, you have to tell them only these many hairs I can implant and this is the result so that they will have one idea how the scalp condition, how their donor area is like. Okay. Then, yes, you need a set of investigations, get it done. Then you can, once after explaining everything in detail about the hair transplantation, if the patient is willing, you can go for a hair transplantation. In ARNA, we are doing follicular unit extraction. Okay. Basically,
Mhm.
it is a procedure of 6 to 8 hours, 1 day procedure
Okay.
wherein the once the patient comes after their investigations is done, we plan up a date and we do give a test dose of a local anesthesia and zero trim the hair. Okay. Then we give the anesthesia for the back side of your hair and there is a motorized punch through which we take multiple punches of your hair. That is the first step which is called as the extraction where we are taking the hairs from the back side of the scalp. Okay.
Okay.
Why the backside is called as the donor area is first thing it is free of hormonal influence which is seen in the frontal area and second thing the number of hairs which are present on the backside of the scalp are more compared to the frontal area. After the
Okay.
hairs which are taken from the backside area, which is called as the occipital area, we do preserve the hairs in a cold environment. Okay. Then we
Okay.
have to make the slits. Slits are nothing but the holes where there is a baldness. There we need to make a hole, and then whatever the hairs we have preserved, those hairs to be implanted there. So totally it takes around 6 to 8 hours. And yes, once the patient is getting discharged, we do give a course of antibiotics, painkillers, everything. And where we have put hairs, we do give him few instructions where is not to wear a helmet, not to do heavy exercises. And shampooing for the first 1 week, it is avoided. First head wash has to be done in the clinic only. These
Okay.
instructions has to be given to the patient. Okay, with all the instructions, you discharge them, and by fifth day you call them back, call for a head wash plain, and show them how you are washing your hair. Okay. Again, a follow up can be done on the 15th day. Once he comes
Mhm.
on the 15th day, whatever the scabs are there, that would have fallen off and the hairs would have started growing. Okay. In first
Okay.
15 days or 20 days, whatever we have implemented, the hairs will start off growing. By the end of 1 month, whatever we have put, those hairs will start falling off. That is called as the shedding phase of hair transplantation. These
Okay.
individual stages have to be explained, otherwise the patient will get tensed up. Because 50 days back only he had got a hair transplantation, and 1 month after the plantation the hairs are shedding off. This is a normal phenomena. Again, these hairs will start growing back by second month end or the third month. By 6 months, yes, it comes to up to 60 to 70% of your hair growth. By 1 year, the hairs will be around 80 to 100% hair growth. Complete hair growth happens. You cut, trim, shave, these hairs will come back for sure. And whatever minoxidil or we are giving, it is only for that period of time. It should be stopped off. You once the
Okay.
hairs are grown, you can trim, the hairs will come back for sure. Because some of them they do have a doubt whether I trim it, the hairs will come back. Can I, yeah,
Mm.
do the particular hairstyle which I want to.
Yes.
All these things can be done. But yes, first 15 days, however, the doctor tells you maintain in that way only. Yes, it tests your patience a lot because the hair will grow, it will fall off. Again, it starts growing. Okay, first probably the 3 months till the hair grow, they will have a doubt when it will start growing, when it will start growing. It will definitely grow. Give it time and maintain the way doctor tells. It will definitely regrow back.
So, such a lengthy process, no, doctor. So, how much the cost range will be for such treatment?
It depends. It depends on the area of baldness. Okay. If the
Okay.
lesser the balder area, less is the cost. The more the balder area, if complete U shape is gone, not in one session it can be done. You may need two
Okay.
sessions. Okay. Depending on the number of hairs lost, it the cost depends. It can be from 20,000 to it starts like that. The lesser the area, less is the cost. More the area, more is the cost. That was.
Doctor, when we were talking about the hair fall, again, I'm going to the first question. So, you were talking about alopecia, where there will be some gaps on the hair or on the beard part. So, why this alopecia comes and can it be treatable?
Yes, of course it is treatable. It's like you can't make it not to happen. Only when those patches, coin-shaped hair patches come, you can treat them. It is like autoimmune response where something is produced
Mhm.
against your hair cells, which are destroying the hairs in that patch. Okay. Here, the
Okay.
hair transplantation will not work for sure. Please don't put them for hair transplantation. They do
Okay.
need some creams, vitamin supplementation, and you can give injections only for that patch. It will definitely regrow back. Around 5 to 6 sessions
Okay.
of a injection with the oral supplementation and the topical cream, it will definitely grow back for sure.
Doctor, one more question. So, which is a quite common question every one of us will have, that is white hair. So, there is a myth also, like if at all someone has got a white hair on their head, if you remove one hair follicle, then your entire head becomes white. Is that really true?
That is not true actually. Yes, with the gray hairs or the white hairs, what you are talking is once anybody in the family is getting a gray hair earlier, you have a chance of getting it early. Tension and stress add on to your gray hair, and deficiency of your calcium pantothenate and all that also adds on. Yes, they do say little bit of a PRP can help for your gray hair, but
Mhm.
not a drastic improvement where all the hairs will become black. No, little bit of a mild improvement can happen with your PRP or the GH. That's what it is. And it is like basically you supplement with the vitamins. You can't make the gray hairs complete black for sure. Okay, it's
Okay.
there and it take some more time and research to make them black. As of now, whatever the little bit of a treatment is there, in that only we need to manage.
So when it comes to specifically to our Indians, so whenever a person sees a white hair, they, generally they link it to the age. So people tend to use different dyes or hair colors, and they apply on their face, then apply on their hair, and then they say like, I'm getting more hair fall. So is there any specific things that we need to observe while we choose hair dye or hair color to make it our hair black or any other color?
See, now, yes, of course, there are hair colors which can be chosen. Okay, first and foremost thing, when you are choosing a hair color, any hair color will have a ammonia that is needed for
Okay.
the hairs to take up the color. Lesser the
Mhm.
ammonia, lesser are the side effects. Okay, so go with
Okay.
the lesser content of the ammonia hair colors. Now, if you
Mhm.
think of many medicated hair colors are available, yes, of course, they are available. Yes, you can use them, and probably with the first session immediately it may not take up the color. Okay, it may take two
Okay.
sessions of it. Yes, it will also take up. There are vegetals. Yes, you can. So many medicated hair colors are available. You can use them. Okay, don't go for the lower versions of a hair color. Okay, always go for a lesser ammonia content hair colors. Yes, it may not damage the hair the way you are using the other colors. Lesser the content, lesser is the damage. That is what it is. Along with that, yes, proper nourishment of your hairs with the hair serum post hair color will also lessen the damage for your hair.
So just like our hair colors or hair dyes, so we use a lot of other things like shampoo, conditioners, hair gel, hair cream, hairspray, whatever that comes in advertisements. We generally people tend to use that. So do we need to consider while choosing a shampoo or a hair gel? Do we need to observe any of the ingredients which should be there or which should not be there?
Okay, sulfates is one thing, okay, which should not be there in your shampoo. That is the one which is giving lather. So generally,
Mhm.
I would say stick to one brand of a shampoo, medicated version also, whichever you are comfortable. There are available,
Okay.
and you can use them. If you are comfortable with the over-the-counter shampoos, always dilute the shampoo and use. Okay, if you are taking 1 spoon of a shampoo, dilute it with 10 spoons of water, then put for your scalp and clean the
Okay.
scalp. Okay, and if you are using a conditioner, never it has to be applied for the scalp. It is to for the length of the hair. So
Okay.
shampooing 3 times a week and using a conditioner only for the length of your hair is a thing how you are used to use your shampoo and the conditioner. Yes, you are using a hair dye or any gels to for your hairstyle and all. Of course, you use it, but at the same time, there are good hair matrix serums are available. Serums are available. Use it, okay? That acts as a
Okay.
nourishment so that it is acting as a barrier for those gels, whatever you are using. It may not penetrate and damage your keratin of your hair. So the hairs will not get cut. Okay? Whatever you use, make sure you are using a good serum to prevent the damage caused by it, and always have a diet which is rich in lots of green leafy vegetables and fresh fruits. Egg a day, yes, it is a complete food. Avoid the yellow part of it. That's what it is.
Okay.
And if you are deficient in any of the vitamins, please do take a supplementation. Healthy diet. Yes, once in a while you can have your junk, but always make sure you are having a good balanced diet and avoid smoking. So, okay, so your smoking acts as a damage for your heart also, your face also, where you age fast, your hairs also, the hair fall will be more. Okay, and along with
Okay.
these things, aging of the face, the smoking gives rise to discoloration of the lips also. So, when these things
Okay.
are very much harmful to the smoking, please stop smoking. This is what it is.
Doctor, along with the hair, the most attractive part of our face is also eyebrows. So some people will have loss of hair in eyebrows. So when such problem comes, can it be treated?
Yes, of course. First, see what is the condition, why it is going. It can be a thinned out hair, eyebrow without any reason, or it can be a patchy hair loss, what we can see on the scalp. Then you treat it as
Mhm.
a alopecia areata, the hairs will grow back. And some of them constant eyebrow, this thing, the threading and all, the hair should have, I mean, the eyebrows would have thinned up. In that case, yes, eyebrow hair transplantation can also be done. Otherwise, nowadays we do a microblading. Okay, it's a tattoo material which is well accepted by the body. And once you get it done, these are strokes which are done. Okay, giving a local
Okay.
anesthetic cream, apply the anesthetic cream, then mark the kind of the eyebrows which they want, then do the microblading. Yes, it will. What happens is it will give the color, same strokes like your hair, the direction of the
Mhm.
eyebrow hairs. It will be there, and it is a pigment. Okay, and these results will stay for 1 to 1.5 year. You can take a touch up after a year or 1.5 year, like that. It's like we do a procedure and send them back after 3 days to 1 week. There can be little bit of the peeling of the where we have put the
Mhm.
microblading on your eyebrows. Then yes, little bit of a color can decrease. That's the reason after 6 weeks we do call them for a follow up. If there is any touch up is needed, we do it, and this will stay for 1 to 1.5 year. Again, they can go for a touch up where they don't want a eyebrow transplantation and a less pain. Yes, they can go with the option of microblading.
So, doctor, the name itself is saying microblading. So, will it cause pain? And suppose take an example, if the treatment is taken, can they go out once the treatment is done, or they have to take any precautions?
Once the treatment is done, they can go out. There will be antibiotic cream which is given. They can use it. Minimal amount of pain if you consider for a hair transplantation and all. We do apply the anesthetic cream, then do the procedure. So it may not be such painful procedure during the procedure. Later on, yes, if they have a little bit of a pain, give them a cocin or a dolo, paracetamol containing tablet. They should be fine. And using
Okay.
harsh soaps and other chemicals on the eyebrows for some time. Yes, we do tell them not to do it. Once it is already settled very well on the eyebrow area, the pigment, we do ask them to use their regular whatever they are using. Soaps and shampoos have to be avoided for that particular part. That's what it is.
So, doctor, we were saying like diet is the most important factor that helps in our growing of hair or glowing of the hair, anything. So, what diet we need to follow for a better hair growth?
See, it's less. One is yes, always have a good amount consumption of water. Okay, around
Okay.
1.5 to 2 liters of water. Your fresh fruits, any fruit is fine. Have fresh fruits, and along with that, all the vegetables are good. Green leafy vegetables, especially your carrot or your spinach, anything of green leafy vegetables is good. Have it. Egg a day is good. Have it. Avoid the yellow part of it. And
Okay.
the other than that, do a little bit of normal physical activity which is good for your body, face, skin. That is also one of the things.
So, what kind of food need to be avoided?
Avoided is whatever I tell, it is the junk, your pizzas, coke,
Okay.
burgers. Avoid smoking. These are the things. Once in a while, yes, you can have them, but everyday routine as your junk, please don't have it. It is not good for your face, body, or the hairs also.
So, thanks a lot, doctor. You have given a lot of your precious time in your busy schedule and answering many questions that our viewers have got in their minds. Thank you so much for your time.
Thank you. Thanks a lot. It was my privilege. Thank you.
Thank you, doctor.